So today we are going to have a look at special tray construction, and as you can see, this is a primary cast that we have got out of our alginate impression. Now this side of the cast, you can see that the vestibule depth is maintained and the width is also maintained. In other words, the trimming of the cast on this side is proper. This is the edge of the cast. We have not cleared it or done any modification to it as it is, and you can see that the width of the cast is maintained. On this side, but if you see, this is the border of the cast again, and you see that the depth of the vestibule or the width of the vestibule actually is not maintained. In certain areas like this, even the depth cannot be sure because you have trimmed off too much of the cast. So you can see that very clearly. I'm going to just clear this cast up. I'm going to use a wax carver, remove off some of the, I think you can see that there, some of the air bubbles in this region. And some of the air bubbles in this region as well. Whenever you want to make a special tray, the first thing you want to outline is the area that you want to relieve. Okay. Like I told you before, this is your incisive papilla, and these are the markings of your rugae. When you're making the impression, we said that this rugae is a fibrous tissue, and so you want to relieve this because you saw that in the impression there was a displacement of the impression material by this rugae because of the dense fibrous nature of the rugae. You also know that the mid-palatine raphe does not have submucosa, so it's very tightly attached to the bone, and if there is pressure on the mid-palatine raphe, it ends up being irritated between the denture and the bone. So this area also needs to be relieved. It's a relief area. We can identify our fovea palatini here very clearly in our cast. This is our tuberosity, this is your hamular notch, and of course the hamular notch on the other side. Okay. The first step when you want to make a special tray is to identify the tissue reflection point. That means, where does the tissue that is attached to the bone leave the bone to form the unattached mucosa? You have to look for the shadow close to where, I think you can see the line I've drawn there. Use my pencil. Close to where the tissue is leaving the bone towards the cheek. Here you have a frenum, very clearly there is a frenum there, and you want to make sure you open up space for that frenum. Always remember that buccal frenums are opened wide while labial frenums are opened deep. Again, as you come over here, you want to follow the same contour of the mucosa as it is attached, and you come to the clear labial frenum that you can see here. And in this case, you want to make a deep opening, not a broad one, a deep and narrow one, so that the labial frenum is well relieved. Compared to the labial, the buccal is more broad. Coming to this side, again, you want to draw a line along the attachment point. You can see the frenum. You want to open it. You want to open it wide because the frenum will move wide. Here is the part that I told you of, the zygomatic process of maxillary bone. This area needs to be correctly shaped. So you want to again go along the border as you would see the tissue attachment. Posterior part, you want to stay between hamular notch and the fovea palatini. So approximately you have to identify the posterior vibrating line in the mouth of the patient. But to make a special tray, you want to leave the extension of the tray 2 to 3 millimeters beyond the fovea palatini, about this location. So you just draw a line across like that.